Hey Moonbeams, Luna popping in. Thank you so much for visiting my page or my channel wherever we are connecting. I appreciate you for being here. Make sure you like, follow, and subscribe so that we will remain connected. Today, I am going to talk about a go bag. A go bag is an essential bag for those of us in the chronic illness community. We should always have a go bag or hospital bag or overnight stay emergency bag ready and prepared at all times so that we can just grab it or someone can grab it for us and bring it to us while we're in the hospital. I started creating and keeping a go bag ready back in about 2017 when I was first really diagnosed and thrust into the autoimmune community and the lung disease diagnosis that I also have. Between 2016 2017, I spent so much time in the hospital that after one time sending my ex home to get a bag ready for me, and he brought me back thong underwear. Mind you, I'm in the hospital for vomiting and diarrhea, total GI episode, and he brings me thong underwear. Like I need any more irritation going on up there, right? So it was that event that caused me to create and keep a permanent go bag ready at all times. Now I'm going to show you the things that I keep in my go bag, and some of them you may say, oh, that's a good idea. Some of them you may not necessarily agree with. Therefore, you create your own bag, customize it with the things that you want in it. But this is mine. One thing to remember and embrace, I highly recommend plastic bags. You're going to need them for a lot of your things. This is a view of the things that I put into my go bag, and I'll go through them one by one. I usually start loading the back of my suitcase first, and I go with my reading materials, the entertainment that goes in the back. Then my snackies. You put these in your suitcase just in the event that you're hospitalized during the time of any meals and you don't get anything to eat. So you have something to snack on. And along with that, you have all your condiments, because they never give you enough in the hospital. And you never know when they're going to try to slip you on that cardiac diet and not give you any seasoning. So, you make your own decisions, but I take my own salt and pepper. And my mustard too. And that goes in the bag in the back. It's important to remember your charger, the cord, and an extension cord. I like an extension cord because you never know how far you're going to be from an outlet. I just take a pair of scissors just in case. And this is my book light. Now when it comes to toiletries, many sizes are the way to go. Mouthwash, body wash, soap, and lotion. Put them in your little plastic baggies and your little disposable containers. And in here I have deodorant, toothbrush, toothpaste, razor, an inhaler, some Vaseline, you know, some more toiletries. And I put them all in one bag. I always put the liquids in its own separate bag just in case it leaks. And then, because an anal Virgo, I put it in yet another bag so it's pretty. And then I put it in my bag. And if you use them, don't forget your wipes. And this is always, always a good recommendation. I mask in earplugs. You can ask for these at the hospital. Some hospitals give these to you, but it's good to have your own. Another dollar store. You can pick them up in the Dollar Tree. And you can't forget your shower shoes. I don't like stepping on bare floors. Who knows how they clean it. And I'm mortified of fungus. So, shower shoes. You keep them in their own bag, so if they're wet, when you finish, you can just stuff them in here if you don't have time to allow them to dry. And don't forget your masks. Those of us who are immunocompromised, it is very important that we wear our mask when we're in the hospital because infection is the #1 destroyer of us with autoimmune diagnoses. You need to protect yourself. So stick a mask in there. You may not need it, but you may want it, and you'll have one on hand. And don't forget your gloves, Raynaud's folks, in case your hands get a little chilly while you're either in the ER or before you get up into your room. Sometimes it can be extra chilly, so make sure you take your gloves as well. In here, I have makeup, moisturizer, eyeliner, lip gloss, lipstick, you know, face beating materials. Pack that up. Your jewelry, your earrings, because when I go to the hospital, I take off all my stuff. I don't wear all of my jewelry in. I'll just leave maybe one necklace on. And I have a pair of earrings in one of the bags that I keep. But in here is just my little bit of magic supplies, my little dream catcher, my evil eye, some crystals, and I have a nightlight. It's a pink Himalayan nightlight that I can just put in my room if I would like to. I have some little crystals and my evil eye that I hang up in the window. You know, if it's a Bible for you or a Quran or a Torah or whatever, do you. This is what I use. And don't forget your thank you cards for the staff. You just leave a general card for all the nursing staff, all the housekeeping staff, all the respiratory staff, all the doctors, or all the room service. Just leave one. You leave, say thank you for your care during my stay, blah, 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 your name and your room number. That's it. Simple gesture. And make sure you have your pens. Have a couple of different pens. Don't forget those. I like to smudge and burn palo and things like that, but we're not able to do that in the hospital. So I take a bottle of Florida water, and I have a spray bottle of sage that I've already packed up that I take with me as well. Or some kind of patchouli mix or what have you is what I do. Socks are very important when you're in a hospital, especially if you deal with Raynaud's and your feet get cold a lot. So I always have thick socks. These are my favorites. And just some other little slipper socks because I don't like to get back in the bed if I walk on the floor with my socks. So I have a couple pair and just a couple of regular pair of socks for when you're going to go home. And in the wintertime, I have some long, cuter ones. Then you have the hair protectors. I have a bonnet and a bandana so I can wrap my hair up should I need to. Of course, your underwear. I have about 4 pairs of underwear and one bra because I don't wear a bra when I'm in the hospital. This is very important. Take your dirty clothes bag. You need a dirty clothes bag. Don't mix those sick clothes with clean clothes. Pajamas. I like to take my own pajamas because I don't like the gowns. But the only time I can wear them is if I don't have a heart monitor, unless I wear this one that has a button down. So make sure you get button down pajamas. See, this one is a button down, so and it has a pocket. So if I have the heart monitor on, it can just go in the pocket, and I can wear my own pajamas, which is what I prefer. I don't like to wear the hospital gowns. And these are just other pajamas. I have my own bathrobe. So if I do have on that gown, I can just throw it over the back and I won't have to worry about my back being exposed. And just a pair of shorts and a tank top, pajamas, just to have extra pair of pajamas. But again, if I have a heart monitor on, I can't wear these. So I need to change all of my pajamas to button down with a pocket, just in case. That's the safest bet. I have just a soft jacket in case I get a little chilly, or if I'm going home and it's chilly and I need to wear a jacket. There you go. Just a change of, just like a pair of bike shorts, a long sleeve shirt, and a couple of tank tops. Because what I normally wear home, I keep this jumpsuit in my bag. It's simple, it's easy, it's one piece. If I don't want to put on a bra, it supports my breasts enough where I won't have to put a bra on. Because sometimes you're just super sensitive and your body is tender and you don't want to put any more pressure on you. So those are the things that I put in my go bag, guys. And I suggest that you get one together and keep one ready for yourself at all times, because you never know. I mean, that's what emergencies are. They're emergencies. And for me, I take my go bag with me when I go to the ER almost every single time, because almost every single time that I've gone to the ER, I've been hospitalized. I am a chronically ill person who knows her body. I know my body, and I know those of us in the community, we don't go to the ER unless it's just absolutely unavoidable because of the way we are treated in the ER, and there's really nothing that can be done except for managing our pain. And sometimes that's all we need to go for. But there are other times, like last time I was hospitalized, I had a severe respiratory incident. So having my go bag ready was absolutely phenomenal, because I couldn't breathe. So I could, how am I going to pack and do all that when you can't breathe? So it's just good to keep these things ready and prepared at all times. So again, we know that we have funny acting bodies, and we know that we're at higher risk of hospitalizations than a normal body person. So it would be in our best interest to make sure we have everything we need for an emergency hospital stay. I hope this helps you guys out. Do you have a go bag ready? What do you have in yours that I don't have in mine? What do you suggest that I put in mine that I may not have? Did I miss anything? But this is what usually sustains me when I'm in the hospital. As long as I have my phone charger and something to read, I'm usually okay. I hope this helps you all out. Peace, love, and blessings. Luna out.